So Dr. Karen Steele, who you can see all of her bio there, so I'm not going to take long, but in the 1980s, Kirksville, Missouri had change in administration and maybe some other things, faculty as well, and we actually benefited by James Stuckey. Jim Stuckey came here as dean, brought with him lots of fine people, one of them, well, two of them including the Steeles, but Karen came from Kirksville, and we'll maybe give you a little more of her history, but we really benefited from the mothership shedding some of its best ovum or whatever. I don't know how that quite works. Karen has grown up in a men's world of medicine, 10% female when she went to medical school in all of MD and DO schools, and she's going to cover that and some many other things related to women's issues in osteopathic medicine. So without further ado, and telling you all about our friendship and stuff we've known over the years, I give you Karen Steele, DO.
Thank you. Can you hear me okay? Yes? We're good. Okay. Well, what fun I have had putting this talk together. You're given a topic like this, the value and evolution of women in osteopathic medicine, and it can be anything, right? You know, and so I had to create a structure, an armature upon which to present this information. And tomorrow night, I'm going to approach the evolution of women in society and then bring that through medicine. But I'm actually going to give stories of women over the last 100 years. And talk about a little bit of the society in which these events occurred, the World War II, the Vietnam War, and so tomorrow's talk is not going to be the same. So what I decided to do today is to do like Lester Holt does. I think Lester Holt is amazing. And so during the Olympics, he would take one athlete and he would interview them before they ever came to the Olympics, and he would show their successes and failures, their training, and then they would show how they did on the Olympics, whether they did well or not. And I decided, well, he's a good role model, so I'm going to talk about stories of women. So let's watch the evolution of women in the healing sciences, women as healers. So we'll go to like 600 BCE, and we'll start out with the Greek gods. And everybody knows Hygeia and Panacea, right? And Hygeia stands for what? What did Hygeia the god do? What was she responsible for? You have to talk. You have to. What did Hygeia do? Hygeia is hygiene, is health, right? So she was responsible for health. So she was the Greek goddess of health. Daughter and assistant of Asclepius, who was the god of medicine. Her cult began in 600 BCE and flourished with the plague in Greece in the 400 BCEs. Now, her sister was Panacea. Now, we think of Panacea today being, it's just, a panacea, it's just something to make you feel better, and it doesn't really have a real physiologic or a real pharmacologic effect. Well, in its origin, panacea actually was universal remedy. So a panacea was a remedy. It was an effective remedy. So she was daughter to Asclepius and sister to Hygeia. So it is from that well that we are now going to develop the idea of women as healers over the millennia. Now, we're going to jump now to 1689 to 1760. How many of you have read the book, The Speckled Monster? It is a lovely book. It's kind of thick and it's kind of slow reading, but it is actually a historical drama. It is a true story with very few variations from the truth. But this is a very lovely woman. She was a poet. She was wife to a British ambassador to Turkey. And she had smallpox as a child, as many people did at that time, and she was disfigured. So she would wear a veil over her face when she went out because that was the social norm. And she went to Turkey, and she noticed that the Turkish women there in the baths were not scarred. And she goes, how does this happen? How can these women not have pox? And she found out that what they did is they had lay healers that would take a little bit of the pus from someone who did have active smallpox. They would make a little scar with an unclean lancet, and they would put a little bit of that pox in there. And then that person would have just a small localized case of the smallpox. That would heal, and they were immune to smallpox. Now, this was quite an idea, a variolation technique for the disease of variola, right? So she brought this to England, and of course, being a woman and not a physician, which women weren't physicians at that time, she was not able to introduce it to the medical community. So she taught her physician, and then her physician introduced it to the medical community. And from there, then came vaccination for smallpox, which was a much safer way of protecting people from the smallpox. But she continued the lay practice, and she had many of the, the regular class of people that used her to treat their families, though the physicians then treated the royalty and the nobility. But she continued as a lay practitioner throughout her whole life. And you can see she's very beautiful here. She did have pox, which they, of course, did not paint into her formal portrait. Okay, now let's talk about this lovely person, Crazy Sally. Now, Crazy Sally was a healer. She was a bone setter. Now, bone setter was a healing tradition that was taught from generally father to son. It was a male tradition, but it was thought to be an inherited gift. And mainly it was used for broken bones and sprains and strains and musculoskeletal conditions like that. And it is thought that actually Dr. Still was impressed with some of the work of the bone setters in America. And so Crazy Sally practiced in England in the 1700s. In fact, this one city in England, a small town, she was getting ready to leave and set up her practice in a bigger town, and they said, we will pay you 100 guineas. Now, I don't know if that's a lot or a little at that time, but I get the impression it was a lot because they wanted her to stay there. And she would hold sessions twice a week in the local coffee shop, and she would do bone setting. So we have a healing tradition started with Hygeia and Panacea. We see it evidenced in a woman who took a lay healing tradition and continued it, and then taught her physician, who then disseminated that among the medical community. We have a woman who was successful in a male-dominated field, which requires some oomph, too. Now, you can see by the caricature here that not everybody thought she was beautiful, but caricatures are not done of ordinary people. They're done of people that are interesting in some way or another. And Crazy Sally certainly was interesting. She affected her community. She affected the perception of women in the healing traditions and the ability of women to be able to do something that required a little bit of brawn. So now let's go. Everybody knows Florence Nightingale, right? Everybody. The lady with the lamp. This is a woman who changed the care of patients. And she did it by being firmly gentle. At one point in my career, I was called a gentle bulldozer. And I think Florence Nightingale was probably a gentle bulldozer because she insisted on a unit of 38 nurses in a British Army hospital in Turkey in the Crimean War. She insisted on strict hygiene. There were no dirty floors on her unit. She did night rounds where she held a lamp, and she would go around and she would touch the people who were there in her ward. And she would check on them, and she would make sure that they got additional care if they needed it. The lady with the lamp. So you can imagine, of course, that the outcomes were much better in her ward. So not content just to do for her own soldiers, which was huge, she established a nursing school. She did this in 1860 at St. Thomas Hospital in London because she was British. And she established the foundational philosophy of modern nursing. The idea of compassionate care for your patients. Checking to be sure they're okay. Touching them. Showing them that you care and that they are valuable. Then let's go to Elizabeth Blackwell. She's the first MD, female MD, in the United States. And she always said prevention is better than cure. She was talking about typhus. Prevention is better than cure. You know, we have the choice as physicians. We can either promote the host or we can do something to combat the invader, the bug. Most of what works is supporting the host, though it's much nicer to come in as a knight gallant and administer some healing potion or do some wonderful surgery. And I am so glad there are gallant knights out there that are happy and wanting to do that. But we must remember that most of healing is hygiene. Most of our patient care is making sure our patient knows that they are a person and that we value them as a person. So she graduated 1849, the Geneva Medical College, first in her class. Now the interesting thing was, even though she was admitted to a co-ed medical school, her classes were a little bit different. She was given a separate anatomy class because they felt like the women's sensibilities were too delicate to be able to handle a full anatomy class. And most of the medical schools at the time, there were women's medical colleges, as you know, and the women's medical colleges taught the women how to take care of women and children. And then the men's medical colleges taught, care for men and women. They didn't emphasize obstetrics quite so much because midwives were still filling that niche, and we'll talk about that in a little bit too. But again, here she is. She graduates first in her class. I'm going to show them, These are not wimpy women. And so in 1857, she founded the New York Infirmary for Indigent Women and Children. Not the wealthy, the indigent women and children. And then in 68, she founded the Women's Medical College at that infirmary. And then in 74, she moved to London and formed a medical school for women there as well. So here we have a very powerful woman who gave back so much. Okay, so now let's talk about midwifery. Up until, really the mid-1700s, midwifery was the way most people had their babies. And in fact, men were not allowed in the delivery bedroom, which it usually was at home. They were not allowed in there. It was thought, why would a man be there? And why would a man want to deliver a baby? And how would he know how to deliver a baby anyway? And so prior to the 1750s, all midwifery was done by women, and they were trained in apprenticeship. 1716, New York City required licensing of midwives. And 1765 was the first formal training school for midwives. And by 1800, there was a decline in midwifery, in the US especially. We're talking because there was a proliferation of medical schools, and they did start teaching obstetrics. And there were social mores against women working outside the home. So those two things contributed to a decline in midwifery in the US. but not in Europe. And how many of you have watched Call the Midwife? I mean, isn't that just the best? If you haven't, it's a Netflix series, and it's based on a true story, autobiography of Jennifer Worth, who was a midwife in London's Lower East End, which was the dock workers, the poor, the immigrant community. And so she wrote a trilogy, and this PBS and BBC series is called The Midwife, is set based on her books. And so you see the life of that group of people in the 1950s in London, in the East End, and you also see the role of the midwife there, and many times the doctor is there to support the midwife. And so it's a very different perspective than what we have in the US. And so she was a professional musician, voice and piano as well. So very interesting woman who gave back, not only working with the poor, but also in her autobiography. So now let's talk about heroic medicine. Everybody knows heroic medicine in the 18th and 19th century. And it was its goal, every form of medicine has a structure upon which we hang our treatments. Why do we do what we do? And heroic medicine was still preoccupied with humors and eliminating effects of disease. So therefore, any disease that had diarrhea was treated in the same way. Any disease that had a cough was treated in the same way. And their treatments were, as you say, heroic, purging, generally with mercury, bloodletting, blistering, and high doses of mercury, opium, alcohol, and arsenic. And so, you've seen the stories of the snake oil salesman. Many times their concoctions were about 20% alcohol. And they were very popular during the temperance movement because, of course, people could not drink alcohol because they'd signed the temperance pledge that they would not drink any alcohol, but they did have their tonic every night. And it was 20% alcohol. So high doses of those things. So now we're going to talk about heroic medicine's most famous failure. Who was it? Tell me. It's right here. George Washington. And here he is being treated, and truly it's the best knowledge they have based on the paradigm that they were using. But what they did, 1799, he got a fever and respiratory distress after riding in the rain. 3 physicians were in attendance. That's like 3 cooks in a kitchen. It's maybe not so good. He was bled 4 times in 24 hours, lost half of his blood volume. Blistering, which also caused more bleeding. Emetics and laxatives, he was given mercury. And he died the next day. So, this caused a lot of thought among some people. And of course, Sir Oliver Wendell Holmes was one of the most famous people that was opposed to the heroic medicine. And he's famous for saying this: if the whole materia medica, which is pharmacology, as now used, could be sunk to the bottom of the sea, it would be all the better for mankind and all the worse for the fishes. And there were some drugs that were beneficial at that time: quinine for malaria, colchicine for gout, digitalis for dropsy, and laudanum, which was opium, for pain. So there were a few drugs that were efficacious at the time, but the doses that were used were part of the problem. So then we have an American medical reform, which is osteopathic medicine. Now here you see a Civil War reenactment, and you see our famous Dr. Still here, right? And Dr. Still actually was, a sort of a surgeon in the Civil War, and he was already an apprentice-trained physician. And so he was providing care to his community. And when he was in the Civil War, he noticed that those communities that did not have a doctor had lower infant mortality rate than those that did. And then as he's practicing, he noticed other things, that people that had a GI distress and were having diarrhea, then they had a coldness, the bloody flux, which could have been any one of a number of things. They had bloody diarrhea. They had a coldness in the thoracolumbar area. He noticed so many things. He noticed a tightness in the suboccipital area when people were having migraines. And he's thinking about all these things, and he's working and taking care of the Native Americans in his area. He's watching the bone setters, and then he kind of pulls it all together in an aha moment, which he describes in his autobiography. He's sitting under a tree, and he said the ram of reason hit him. You know how you get that aha? And he said there needs to be a different framework for medicine. And so the framework that he adopted is the body as a unit. Not only a short leg's going to lead to a lumbar, bend at least, if not a scoliosis long term, but it's a unit of mind, body, spirit, which was kind of an interesting concept at the time. The idea that the body has self-healing capabilities. Many of the things he proposed we now know to be true. Axonal flow, endorphins, these are things that he proposed because he saw that people, if they weren't interfered with too soon or too much, most of them, if their host was not overwhelmed, they could manage to come out of that disease and heal themselves with a little bit of help from the physician. And so body has self-healing capabilities, and structure and function are interrelated. If you wear down the medial aspect of a knee and the leg starts going like that, and then you're walking on that, you're going to develop arthritis in that knee, right? I mean, it's not something that should be ignored for the long-term health of that person. Not only their gait, not only their athletic function, but their pain, their mobility, their quality of life. So he put all of this together, and then he called it osteopathy. And he believed that if you did manipulation in the suboccipital area, you could help headaches. And he did. And we know that's true. I mean, most of us have experienced that, right? In OPP lab. Suboccipital release is so wonderful. When I was doing a hospital practice, that was the number one thing everybody wanted done. They said, you can do whatever else you want, but I want you to do that one. Because it is it provides so much stabilization to the autonomic system, suboccipital area. And the idea that if you could do manipulation in the lumbar area and you could increase the flow here, then now we know that if you increase the flow to the structure, you're also increasing the flow to the organs that are innervated at that same level. And so at one point, he was admonishing one of his students who was using forceps in a delivery, and he said, turn on the ovarian artery. Ovaries are T10, right? Turn on the ovarian artery. Give them some lumbar inhibition at T10, and you probably won't need the forceps because then the uterine contractions will probably start or pick up. So he took this to its nth degree. And so manipulation was used not only as the bone setter uses it for various sprains and strains, but then it was also used to affect the spinal reflexes. So it's an American medical reformation. So 1892, he established his school. He had so many patients. I grew up in the Kirksville area, And I know the Travelers Hotel, which was built right on the train tracks because people came in train loads. And they would come in their wheelchairs and their crutches, and they would walk across the landing, you know, the wooden platform, and go straight into the Travelers Hotel. I mean, he was that famous. He was that effective and that novel. Of course, he was a little bit of a showman as well. And so he established his school in 1892. There were 22 enrollees, of which 6 were women, so a 27%. And he actively encouraged women to come in the class, and he didn't treat them any differently. They were in the anatomy lab, they were doing the urine scopes, they were doing everything. And so these are some quotes. From the first day of classes, women were admitted into osteopathic medicine on a completely equal basis with men. And then Dr. Still says, the women have done well in the classes, clinics, and practice, and are as well worthy of diplomas as any gentleman. Of the 6 women in the first class, 4 completed the program and received degrees. So now let's talk about one of those women, Jeanette Nettie Hubbard Bowles. Now, she was the first woman to become a DO because they lined up alphabetically, right? And she's B. So she was the first American osteopathic female. And so it's pretty easy to be the first in a whole lot of things when you're the first DO female graduate. She was the first female faculty member in the profession. She taught anatomy. She was the first editor and publisher of the Journal of Osteopathy, which is now the JAOA. So she established the JAOA. She was the first president of an osteopathic college in 1897. She and her husband were both graduates in this year, but she was the president. And in 1917, she was nominated as president of the AOA. She didn't win, but she was nominated in 1917. Pretty impressive woman. So then let's go to Louisa Burns, who's like a half a generation later. And she had spinal meningitis as a young woman, and she was helped a great deal with osteopathic treatment. So she wanted to become a DO. She graduated from the California School in 1904. So what would she study? Spinal reflexes, since she had spinal meningitis, right? In human and rabbit models, she was director of the A.T. Still Research Institute for 40 years. And let's give you a little perspective here. When we started, 27% of the first class was women, right? In 1908, 35% of all DOs were women. And by 1923, 50% of all DO students were women. So women were doing very well in osteopathic medicine. Now let's jump a little bit forward to Dame Professor Fryman. Sadly, she passed away in 2016, but she was a powerhouse for osteopathic medicine, or osteopathy as she still called it. When my husband and I graduated from Kirksville, it was the Kirksville College of Osteopathy and Surgery. When we started, Kirksville College of Osteopathy and Surgery. So she was born in England, actually, had osteopathic treatments from age 4, and she wanted to become an osteopath. There was a British School of Osteopathy, and she wanted to become an osteopath. But during World War II, that school was closed, so she became an MD. And so in an interview that I read, it's just a lovely interview of her evolution in her professional and personal life as well. She talks about practicing during the Blitz in London. So, she would go to her clinic during the day. In the evening, then they would triage all those that were injured during the day and arrange for them to get treatment, surgery, or whatever they needed the next day. So she practiced during the Blitz. And she learned homeopathy and taught homeopathy there, but her love was osteopathy. So she said she took a one-way ticket to California And in 1949, she graduated from the College of Osteopathic Physicians and Surgeons in Los Angeles. And she received advanced training because she was already a physician. Now, her goal was to be an osteopath. She wanted to treat children. That was her goal. She had no goal as to be a politician or to be in any other way except she wanted to help children. But what happened? In the 1950s, as many of you know, was the California merger. And in 1961, the California legislature signed a law that made it illegal for DOs to obtain licensure in California. Those who were already in California could stay if they wanted to. The Osteopathic College there was taken over by UC Irvine, and in fact, in their basement, there are archives down there of the Osteopathic College that existed before UC Irvine took over. And they had an enormous osteopathic hospital that was also appropriated. And so there were a few DOs that were left. Most of the DOs were given the opportunity, if you want, you can pay $65 and we'll grant you the MD degree, and you can stay in California and you can practice wherever you want to. It didn't exactly work out that way, but that was the plan. Now, there were some DOs that said, no way. And Dr. Fryman was one of those who said that. So they established the California Osteopathic Physicians and Surgeons. And believe me, they were politically active. And they were able to get this law reversed in 1974. So the fact that some of you can go to California and practice is because of people like Dr. Viola Fryman. Because there is an osteopathic college there, because there were osteopathic hospitals, now they're, integrated hospitals, are because of her and a small group of other DOs. So then she went on to establish the Osteopathic Center for Children, and through that she invited people from all over the world to come and learn how to treat children osteopathically. Most of them were osteopaths from other parts of the world. And then she started going to other countries as well. She was all over Europe and Russia. She taught osteopathy throughout the world until her death. I mean, you can see how infirm she is here. She's still writing coach class. This is taken at a conference where we taught in Canada. And she's still writing coach class. And she did that until she was like 90. So you can understand why she was known as Dame Professor Fryman. She was a powerhouse, really something. And so now let's bring up to current time. Dixie took Rollins, was actually just 2 years behind me at KCOM. She grew up in the rural Midwest, practiced for about 15 years, and then in 2001, she became the founding vice president and dean of VCOM. Founding vice president and dean. She established the school. In 2001, she moved there, and she started saying, what kind of school do we want? Do we want a library with books, or do we want an electronic library? Asking questions that when you build from the ground up, you can ask. What is the role of OMM going to be in this curriculum? And their goal was to provide practitioners, as she says, my personal mission is to help provide more physicians for rural communities. We're trying to build a medical school that will produce compassionate, caring doctors who want to work in rural areas. In 2015, she became president and provost. She has 3 branch campuses, and they have medical clinics. The school has clinics in the Dominican Republic, Honduras, and El Salvador. She came with the idea of an international focus and a rural focus. And she was able to do that because she built that college from the ground up. And as you can see, VCOM is very successful. So, now we have another powerhouse, and we'll bring it up to today. And this is Kelly Ward. She's one of our graduates, so many of the faculty will know Kelly Ward. She was born in 1969 in Fairmont, graduated from here in 96, and practices family practice north of Phoenix. Now, in 2002, she won a seat in the Arizona State Senate. Now, she didn't do that just because she says, oh, I think I'll go into politics. I mean, she was a political dynamo as a student here. I mean, she was politically involved all the way up from local to national at that point. Her goal is to become president. That's a goal, isn't it? So that's her goal. So in 2012, she won the seat in the Arizona State Senate. In 2016, she relinquished that seat so she could run against U.S. Senator John McCain in the primaries. Now, that takes a little chutzpah, right? To run against Senator McCain. Of course, she lost. But 2018, she's going to run against Jeff Flake for the U.S. Senate, and he's recently announced that he's retiring from the Senate. I have a friend who practices in Tucson, and she says that people pretty much assume that Kelly's going to get it. She has a very good chance of winning that seat. And if she does, there are only currently 3 MDs in the Senate, and they're all men. So she would be the first female physician and the first DO in the Senate. They're the only at this time. So there's her website if you want to get on that and check her out. So women today, we started out, remember, women were 27% of the first class. Now we have 41% of all DOs are women, 47% of all DOs under age 45, 44% of all DO faculty, and 67% of all DO staff physicians in the clinics and hospitals. So women in medicine today, it's almost 50-50. In your classes, it is 50-50, which is what a wonderful thing that is. To be able to share men and women in this training. And so I just congratulate you, and I'm so proud of you, and I am so happy for you that you have accomplished that. Now, tomorrow night, what I'm going to do is talk about the women on whose shoulders each of you are standing in order for you to be here. Because we didn't just get here because we said, I think I'm going to do that. We got here because someone else did something that allowed us to be able to have that opportunity. And that's going to be my message tomorrow night. So here's some recommended reading. The Speckled Monster is about the smallpox. Women in Science is just a lovely little book. One of my daughters sent to me, and it's kind of cartoonish. It's really designed for the teen girl to inspire them into a career in STEM. But it is very interesting to note that in 1970, only 14% of the people in STEM were women. And so where were the role models? And then The Feminine Touch is a really sweet little book too. This was written by a DO who's from Florida, from Sarasota. And it profiles different women throughout osteopathic medicine. And it's just a little 2-pager about each of them. So it's a very nice little reference for you, something you can look up if you have any interest. So I think that is where I will stop. So
let me stop just a second and say, because we're going to go to questions here in just a minute, but Karen, I just wanted to thank Dr. Karen Steele for what she's done in putting this together. She is speaking, she's the past president of the American Academy of Osteopathy, the 10-fingered bunch, and one of the first women to chair that. But in addition to that, she's also lecturing this year at the American Academy, which starts next week in Dallas. So she'll be there again representing the profession. She's just a wonderful thing, but I want to make sure you caught that tomorrow night she's also speaking in here, 5 to 7 dinners at 5:30 she'll start. And it's another subject. It's really the shoulders that we all are standing on here of the women throughout osteopathy, but it's an entirely different talk. So thanks to Karen. I want to say Viola Fryman also was here at WVSOM 4 or 5 times in the 70s and 80s. And Kelly, who's going to run for Senate, her mother graduated from here in the mid-80s. So she had some shoulders to stand on as well. But thank you very much.
Thank you.
Karen. Are there questions? Anyone want to talk to Dr. Steelen about her illustrious and rigorous career, or how to raise 2 girls, or one of them's a
We have
DO?
4 children.
Yep.
2 girls are DOs. They're married to DOs. Tom and I are DOs. Tom's brother is a DO who has 2 sons who are DOs. So I have one daughter who works in Division of Family Services, and sometimes at dinner she'll go, boring.
So, yeah, the MDs didn't have any chance in the Steele family. So.
Actually, it's a funny thing. Growing up in Kirksville area, there was one MD in town and like 150 DOs, you know. And my youngest daughter, who is now a DO, a pediatrician, and in practice up near Parkersburg, but one day she says, "Mom, what's an MD?" It's a little bit more balanced now, but you know, that's what it was like in Kirksville at that time.
Yeah, no, you can't say that many places. I don't know there's any other place that you could say that.
In fact, it was featured in Portland, Oregon. We saw an article about Kirksville in Portland, Oregon one time, and it said, a town with 151 physicians and one's an MD. But this was in the Portland Oregonian paper, an article about Kirksville.
Any other
Do
comments
you have
or
thoughts?
Well, they didn't study their Greek mythology because didn't have one speak. Yeah, here's.
Say it again, please.
Dr. Wall just said that she was the first DO to be licensed to practice in South Africa. So she spent 3-4 years, how many years with Adrian Biesmeyer
Yes.
putting that together?
Adrian Biesmeyer and I together did another gentle bulldozer sort of approach in South Africa with the sponsorship of the school and her foundation and some of our own personal funds as well. And I was in South Africa 5 different times, meeting with every single person we could meet. We had a spiel ready that we could give to anybody that would listen. And one time we were packing up, we were getting ready to go, and someone says, well, so-and-so says they would like to hear about osteopathic medicine and what it might do for South Africa. And you know, Adrian's father is Harry Belafonte, and so she goes, the show must go on. Okay, so we did it. But eventually they did recognize me as a fully licensed physician in South Africa. They have osteopaths there, but they didn't really have a mechanism for a DO to be licensed as a physician because it's not in their paradigm or in their model. So every time they kept trying to put me in the allied health, I kept having to push myself back over into the physician category. And finally there was one email I got from one administrator, and he says, I can find no legal reason to deny you this. So we worked very hard, and really the school was such a wonderful sponsor of this initiative too. And so that was truly a joint effort of Adrian and mine and many people here at the school.
All right, thank you. She'll be up here to answer questions. You want to speak with her personally. Thank you. Thank you, Dr.
Thank you
Karen.
so much.